fixed pinky and ring numbness in 1 week. In less than 1 week, I was able to help Justin get 90% relief from pinky-sided wrist and hand numbness that he had been dealing with for 6 months. If you find this hard to believe, then keep watching. I'm a physical therapist who has specialized in treating wrist and hand issues for the past decade. I've spoken at medical conferences, published studies, and written chapters in textbooks about my work. Pinky-sided numbness and tingling can occur for many reasons, whether it be from cubital tunnel, Guillen's canal, thoracic outlet syndrome, or even local nerve irritation from the FCU origin. This case study goes over a simple case of nerve irritation from the chest. And this is an area that many healthcare professionals often overlook when evaluating their patients. So let's get into it. So what was going on with Justin? He works in operations and is also an ex-professional gamer. And he was dealing with pinky-sided numbness that would worsen with gaming and affect him at work and at the gym. The sensation was rated at a 6 out of 10, and it was something he had been dealing with for about 6 months. Justin also went to see a chiropractor who only performed manual work, but couldn't help him understand what was going on. He wasn't provided any exercises, lifestyle, or posture recommendations, just manual work that was provided. And here are some of the activities that were affected. After about 1 hour into playing games, Valorant, he would feel a consistent 4 out of 10 that wouldn't go away. Halfway through his workday at around noon, he would feel a 6 out of 10 that would also last for the rest of the day. He also noted that during chest exercises at the gym, guillotine press and chest flies near the end range of motion, that led to some chest discomfort. I'll let you guys know why this is important in a little bit. When he stretched his wrist and hand, it seemed to only help him temporarily. Just some other lifestyle factors: he's a side sleeper, he goes to the gym 6 times a week with a structured program, and Justin's main goal was to get some relief so he could get back to work, working out, and gaming without any numbness or discomfort. So Justin was actually dealing with pec minor syndrome, a type of thoracic outlet syndrome. And it is a nerve issue, an ulnar nerve issue that occurs as a result of the muscle of the chest known as the pec minor being tight. And this tightness can lead to compression or irritation of the ulnar nerve as it travels beneath the pec muscle down to the arm. And the tightness developed as a consequence of his posture, his lifestyle, and activity. In certain postures that I'm going to be highlighting in this case, this muscle is placed in a shortened position. And when we spend 8+ hours each day in this position, adaptations can occur, leading to muscles changing in length or becoming more stiff. And this occurs over weeks to months until the nerve eventually becomes compressed or irritated. And with his focus on bodybuilding and advanced weightlifting, he also trained in this shoulder position that can further exacerbate the problem. Chest exercises can lead to short-term increase of stiffness following the workout, which can also cause compression. And as muscle size increases, it may also potentially reduce the space for nerves to travel. I want to just touch here that there are always good and bad of every profession, in this case, a healthcare professional. It was just unfortunate that when Justin sought out a chiropractor, they only focused on short-term interventions without trying to teach him how to resolve it on his own, how he can use exercise and lifestyle changes to really get long-term relief. Part of my work with Justin was to help him understand more about how his daily activities, his postures, and movements over time likely contributed to the development of his injury. So let's get into the actual details of the examination. With all our evaluations, we go through thorough questioning, clinical tests to rule out some more serious involvement. Here are the relevant results of the examination, outside of what was determined above. The source of the pain was the medial cord of the brachial plexus, or the ulnar nerve. Now, the cause of the pain was his sedentary work lifestyle, prolonged sitting at work without regular breaks, poor posture while sitting and gaming with this anteriorly tilted and protracted shoulder position leading to that pec minor tightness. His exercise programming was not considerate of the chest contributions to the nerve irritation. The chest exercises created situations of compression and tightness. His pec minor length on the right was 50% of what we found on his left. He also had weakness of his serratus middle and lower trap on the right side. He also had a positive nerve tension test for his ulnar nerve on the right side compared to the left. And with these issues, we designed a program to address all of those deficits. And it was actually really surprising to see how quickly we were able to resolve his issues with that targeted program. And keep in mind, this program worked for Justin based on the specific things I was able to identify during testing. This is, however, just a good general shoulder prevention and management program for those that might have issues in the same area. But you should always seek out a physical therapist to receive an assessment and an individualized treatment program for yourself. The first thing we looked at was to help him improve his overall posture awareness and incorporate more regular stretching throughout his breaks and exercise. So what we did was I educated on better overall sitting posture, focus on posterior tilt of his right shoulder. We integrated stretching throughout his day, after every hour performing a single pec stretch, and between his exercise sets when viable. We also implemented the exercise program I shared above to address the tightness, the weakness, and the tension that he noted at his chest. And within this program, we focus on mobility first, then improving the endurance and control of the muscles around the shoulder that will allow him to maintain or have better awareness of that position. We followed up 1 week later.
Almost immediately after my first set of stretches and exercises that Matt gave me, I had pretty much like 80% relief. Got rid of numbness completely in one of my fingers. Felt like my chest kind of opened up a bit. I didn't have that tight like knot in my chest that I had for so long. My benches went up since then, and my military presses went up since then just because of the overall comfortability.
He no longer felt any issues with playing, was able to work the entire week without any numbness or tingling, and had no days where it felt as though it was limiting his ability to use his hands and his shoulder. And here are some of the changes that occurred with his stiffness. His pec minor length improved from 50 to 70% of his left. He was able to improve his strength, and the 1 week change was likely more associated with better signaling rather than an actual increase in his strength. His nerve tension was normalized. And what's interesting here is that while the length of the pec minor wasn't completely normalized, he was still able to resolve his issue. Meaning it's still okay to have some form of tightness and stiffness as long as it's not getting to a point where it's actually irritating the nerve. So what can we learn from his specific case? First, it's important to recognize that most cases don't resolve this cleanly and simply. Everyone has a different lifestyle, environment in which they spend on the PC, your desk, your chair, your monitor setup, and overall physical conditioning. And in this case, and many others we have seen, the main cause of nerve irritation resulted from shoulder position. It's not the position itself, but it's the poor posture on top of sitting in the position for an extended period of time without taking breaks, and that accumulating until the nerve actually being irritated. So if you layer on physical inactivity, it can also increase the risk of developing this type of problem. Because when we sit for extended periods of time, it's been shown to lead to increased resting stiffness of muscles. This has been shown many times in the research, and any extended sitting without breaks can lead to general detrimental effects on our physical health. In this case, with a more anteriorly tilted shoulder position, it can lead to the muscle becoming more stiff after longer sessions of sitting. So by performing regular exercises, taking breaks, and doing this preventatively, can likely reduce the risk of developing this type of issue. Exercises are going to be the way that you can achieve long-term relief, not only with pec minor issues, but also with issues at the wrist and hand. What's more important is that you actually take control of your own health. You have to find a healthcare provider who can actually teach you more about your own physical health and actually take your conditioning and your lifestyle into consideration. Only then can you make the right modifications to your schedule, your posture, and perform the exercise to stay healthy while working at a desk or gaming. And that's pretty much it, guys. Hope you guys enjoyed this case study and learned something from it. And if you want some direct support from us, check out that link in the description. And if you want to learn and try other exercise routines for the shoulder, check out this video right over here.